Hi Aziza, how are you today?
Good, how are you?
I'm very good. So this is your first time seeing me, okay? I saw in your chart that you're here just for a general exam, but that you had some concerns. Could you go ahead and tell me about those?
I just had some numbness and tingling in my back and
Okay.
around my body.
Okay. So your back and body. Any areas of the body that this is particularly bad, or is it just kind of coming and going and you're not sure?
Just coming and going, yeah.
Yeah. Sometimes it can be hard to pinpoint if there's a neurological issue, you know, where you're feeling numbness, what's tingling, but you just know that something's off. Okay. How long has this been going on?
A few days.
Okay. Does it get worse at any time of day, in the morning or at night?
A little bit more at night.
Okay.
Yeah.
So how long has this been going on?
A few days.
Okay, a few days. And is it at any particular part of the body?
More of my back and lower region of my body.
Okay. But you still kind of feel it in the upper body as well? Okay. And so right now, on a scale of 1 to 10, how would you rate the pain, the tingling?
I rate it a 7.5.
Like a 7.5,
Yeah.
so it's pretty bad. Okay. Do you have any dizziness on standing?
A little bit.
Okay.
Yeah.
And are you doing anything to alleviate the pain? Are you taking any medications over the counter?
No medications, I just do stretching, but it doesn't really
Okay,
do
stretching.
anything. Yeah.
And any changes to your diet in these last few days?
Not really, no.
Okay, no changes. And have you been using any topical soap or ointment or anything that you can think of that might be new and affecting this?
I mean, I tried a new skincare product, but that's about it. Yeah.
Okay.
Yeah.
What is the skincare product?
It was just a new moisturizer.
Okay. We'll put a pin in that because it's rare for that to cause a full-on neurological problem, but you'd be surprised sometimes that just the products that we use can just throw our bodies off. Okay, and have you experienced any fall in the last week?
No.
What about in the last 6 months that you can think of, a fall or an accident, a car accident, however minor?
I tripped down the stairs once.
Okay.
That was about it. Yeah.
All right, when was this?
Maybe 4 months ago.
Okay. Okay, and did you have to go to the hospital for that?
No.
No, okay, so you just had a fall, and so that's a long time ago for you to be suddenly having symptoms.
Yeah.
It's probably not connected, but I just wanted to gather as much information as I can. I'm just going to ask you a little bit about your family history and your immediate family, grandma, grandpa, mother, father, sisters. Do you have any of the following? Neurological disorders?
No.
Okay. Blood disorders or lung disorders?
Not any that I can think of.
Okay. High blood pressure?
No.
Okay. Fibromyalgia?
No.
No problem. Okay. Diabetes or blood sugar issues?
Yes, it's on my mom's side.
On your mom's side? Okay. And is your pharmacy, I see here, the Walgreens on Magnolia Street? Okay. Just in case we need to order anything for you today. Any other things that you would need to be checked on today? Any issues with vision, hearing, headaches? Pretty healthy overall?
Yeah, other
Great.
than that, that's it, yeah.
Okay, so I'm going to just be checking your vitals first, then we're going to do a cranial nerve exam, and I'll be checking just the sensitivities in your back, shoulder, everything like that, okay?
Okay.
Do you have any questions?
No.
Okay. I'm just going to start by putting on some gloves. Listen to your heart and your lungs, okay? So you don't have to do anything, just breathe normally for now. Okay, are you a smoker?
No.
Okay. I'm not hearing any congestion in the chest. Heart sounds normal. I'm going to listen on the bell side for murmurs. Okay, beautiful. I can only hear S1 and S2, no S3. Very healthy and steady heartbeat. Okay, I'm going to listen to your sides, all right? So just take a few deep breaths for me. Good. Okay. All right. Excellent. Sounds normal. I am going to go ahead and listen on the back. So if you could go ahead and turn around and face that tree right there. Right, excellent. So. Okay, all sounds are normal. You can go ahead and flip back around. I'm going to take your blood pressure. Do you have an arm preference, or is this one okay?
This is fine.
Okay. Okay, just make sure your ankles are uncrossed. Okay, 102/72, so that's really good. Do you exercise?
Yes.
Okay. Definitely have the blood pressure of someone that exercises a lot, so that's good. Okay. So I'm going to take your oxygenation and your temperature. If I could have your index finger. Beautiful. Go ahead and rest it here. Okay. So yes, your heart rate is 74 beats per minute, which is perfect range that we want to see. And your oxygenation is 99% at room air, which means that your body is taking in oxygen very, very well. All very healthy so far. Taking your temperature. (96.8). Okay. So what I'm going to do now is palpate the face, okay? So go ahead and close your eyes. I'm just feeling for any enlargement of the lymph nodes. The skin is well perfused. I'm not noticing any preauricular lymph nodes that are protruding. Postauriculars are fine as well. Now as I lay my index fingers directly on each side of the face, do you feel that equally on both sides? Okay, very good. I'm going to be tugging at your ears. Let me know if I'm tugging up, down, back, or forward.
Back. Up. Down. Forward.
Okay, very good. Just going to feel your lymph nodes are normal. I'm going to just be feeling the back of your head. Any signs of lumps or bumps or a concussion? Any pain there when I press? Okay. All right, I'm just going to be judging the strength of your facial muscles, making sure that they're congruent with each other.
Okay.
So go ahead and raise your eyebrows. I'm going to try to prevent you from doing that. Very good. Now raise them all the way and try to lower them. Okay, very good. Now I want you to try to turn your face to your left. I'm going to prevent you from doing that. Ooh, very strong. To your right. Excellent. Now try to look up at the ceiling for me. Okay, and now try to bring your chin to your chest. Very, very strong. Okay. I'm going to be doing some percussion, so you're just going to feel some light tapping on the face and just looking for signs of edema.
Okay.
Okay. Go ahead and close your eyes. Good. Okay. No signs of swelling. Okay. See your arm. Okay. All right. Just going to be taking a look at the face, so just go ahead and close your eyes. Just making sure the skin isn't showing any signs of irritation. The skin is very well perfused. Okay. Not seeing any signs of redness, purpling, bruising, any signs of an internal issue. Okay. Just gonna look inside the mouth. Go ahead and open for me. Okay. Tonsils are normal, healthy in color. Gums are healthy. Tongue is pink and moist. Okay. And I'm going to do just a few measurements of the face to look for signs of drooping. Just looking for basic symmetry here. Okay. 3/4. In here. Okay, almost 11. 4. 3 centimeters. And 3. Okay. I'm going to go ahead and focus on your vision right now. So I want you to let me know when this light enters your field of vision.
Okay.
So focus your eyes on maybe the tip of my nose. And whenever you see this light in your peripheral, say now.
Okay. Now.
Good.
Now.
Good.
Now.
Good.
Now.
Good. Okay. Okay. Go ahead and look straight ahead for me. I'm just going to be taking a look at the pupil, making sure it's round and reactive to light, which it is. Okay, no signs of eye infection, jaundice, scarring or scratching. Go ahead and look up for me, look down, to your left, to your right. Excellent. Okay, did you feel dizzy at all doing that?
No.
All right, I'll look at the other eye. Okay, look straight ahead. No issues here. Go ahead and look up, look down, to your left, to your right. Excellent. Do you wear contacts or glasses?
I do wear contacts.
Okay.
I have them in right now.
Oh, great. Okay. And when's the last eye exam you had?
About 4 months ago.
Okay.
Yeah.
All right, perfect. So you're good to go in terms of that. Just going to check to make sure. So I want you to just hold this at arm's length if you could. Beautiful. Okay. Could you read the third row for me?
F, P, H.
Good. And then this row right here?
D, H, J, B, S.
Good. And then can you read this last row?
L, T, F, P, H.
Good. What color is this?
Green.
Good. What color is this?
Orange.
And is this circle number 8, is it larger or smaller than number 5?
8 is larger than 5.
Good. And is 5 larger or smaller than number 2?
5 is larger than 2.
Perfect. Okay. Go ahead and face me and let me know. Very good. Let me know which fingers are moving, the ones on your left or your right.
The left. Right.
Good.
Left. Right. Both.
Okay.
Left. Right. Both.
Okay. And the ones above or below? And look straight at me.
Below. Above. Both.
Very good. Okay. Your vision does not seem to be compromised. Okay. I'm going to go ahead and look inside your ears. Okay, go ahead and look straight ahead for me. Tympanic membrane is a nice pearl gray. I don't see any scarring, scratching, no excess wax. Well, you do have a little bit of wax, but it's not, doesn't look to be obstructing my view of the membrane. Okay, just gonna look here, just around the outer edges of the auricle. Just looking for any fungus, any signs of infection here. It looks very healthy. These are very cute earrings, by the way.
Thank you.
Okay. Then look at the other ear. Okay. There's like no wax on this side, so that's good. The membrane is pearl gray. Nothing obstructing my vision of it, and no scarring or scratching. I'm going to just go ahead and peek up here again. Any hearing problems?
No.
Okay. Ringing in the ears or hearing things that aren't there?
No.
Okay. Just gonna look behind here too. Very good. Okay. Go ahead and close your eyes. Let me know if you hear the rustling on your right or your left ear.
Left ear. Right ear. Both ears. Right ear. Left ear. Both.
Okay. I'm going to give you two sound options, option A or option B. Let me know which sound is closer to your ears, okay? A or B?
A.
Okay. A or B?
B.
Okay. A or B?
B.
Okay, very good. I'm going to bring this tuning fork to your head and just along different resonance chambers of the scalp. Let me know when the sound stops. You should feel a vibration as well, but mostly we're focusing on sound.
Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Okay.
Stopped.
Good. Okay. Great. Okay. So next we're going to do a sharp or dull test, okay? This is going to be a dull sensation on your skin. This will be sharp. Go ahead and close your eyes. Let me know which one you feel, okay? And you can whisper this one.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Sharp. Dull.
Okay. Very good. All right. Next we're going to do a wet or dry test, okay? So I'm going to take this. And with the tissue. Okay. So go ahead and close your eyes and let me know if you feel a wet or a dry sensation.
Wet. Dry. Dry. Wet.
Okay. Seem to have a good handle on those neurological functions. So, okay, Aziza, I have a few more sensory tests I'd like to do, plus a smell and taste test. Then we'll move on to your abdominal and back exam. I'm going to give you a gown to change into, and then we'll continue that.
Okay.
Okay. Next, I'm going to do a pressure point test, okay? So this will be 1 pressure point. This will be 2. Go ahead and say 1 or 2.
1, 2, 1, 1, 2, 1, 1, 1, 2, 1, 2, 2, 1, 2, 2, 2, 1, 2, 1. Good job.
Very good. Okay, so this is a seashell. This is paper. Go ahead and say paper or shell.
Seashell, paper, seashell, paper, seashell, paper, seashell, seashell, paper, seashell, paper, seashell, seashell, paper, seashell, 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 paper, seashell, paper, seashell, 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 paper, seashell, seashell, paper.
Beautiful. So this is butter and this is paper. So go ahead and say paper or butter.
Paper, butter, butter, paper, butter, butter, paper, paper, butter, butter, paper, paper, butter, 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 paper, paper, butter, paper, paper, butter, paper, paper, butter, butter, butter.
Okay, some of those wrong. That's okay. Okay, so this is going to be staple, and this will be butter, and then I might throw in some paper too, so watch out for that.
Okay. Butter, staple, staple, butter, paper, butter, staple, butter,
Good.
paper,
Good.
staple, 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 butter,
paper, paper, staple, paper, 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 staple, butter. Excellent. All right. And next, we're just going to do seashell or butter, and then we'll be finished with this portion, but I'm not too concerned. Okay. Butter, butter, seashell, butter, 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 seashell, butter, seashell, seashell, butter, butter, seashell. Okay, that seems to be intact. Okay. Gonna move on to do a smell and taste test. First, I just have a few scents for you to smell. Go ahead and inhale. Let me know what this smells like. Like lavender? That was vanilla.
Vanilla.
So just a little bit off, but that's okay. Okay. Go ahead and inhale.
Oh, that one's lavender.
Rose, but very similar.
Oops.
At least you have the plants. You're in the plant frame of mind. Okay. This one's a little bit difficult, but go ahead and do your best.
Like spearmint or something.
Sandalwood. So, I think you might be having a cranial nerve issue there. Definitely not passing this test. Okay, good luck with this. It's really hard.
I can't even smell anything.
Go ahead, try again.
Like wood.
It might be, it's called a vetiver. I'm not quite sure what that is myself, but we're gonna say failed that one. One more, this is, I'll give you a hint, it's in the floral family, so it's another flower.
Lavender.
There's no lavender here. It's geranium. Okay. Go ahead and inhale.
Like, it's like floral or something.
It's frankincense, so I'm definitely going to refer you to a smell doctor to get yourself further checked. You're very healthy otherwise, but having some issues with smell. Do you ever smell anything that's not there, especially smoke or metal?
Sometimes.
Okay.
Yeah.
Which one would you say?
More like smoke.
Smoke. Okay. Definitely making a note of that in your chart. Okay. Next we have a taste test. I have a strip of paper. Go ahead and open your mouth and close it. Open it again. What would that taste like to you?
Paper.
Good, that was a control paper. Okay, go ahead and open, close, open.
Also like paper.
All right, so that was supposed to be cinnamon. I'm going to just write that down. Okay. Okay. So I think I am pretty pleased with the sensory test portion of this. I'm going to go ahead and move on to an abdominal exam, okay?
Mm-hmm.
All right. Just going to listen to your stomach. So you look for any extraneous sounds, abnormal regurgitation. Sounds are healthy. A little bit of gurgling. Any stomach aching issues or gastroenteritis history?
No.
No, okay. Are you easily nauseated? Do you get motion sickness?
Not really.
Okay, that's good. Excellent. Okay, I'm going to just palpate on the stomach. Okay, that means I'm going to just slowly press down and just feel your organs, making sure that your liver and spleen are normal in size, okay?
Mm-hmm.
All right. Let me know if you feel any pain. Okay, normal. Okay, I'm pretty pleased with that. I'm going to go ahead and just do a quick examination of the feet.
Okay.
And then we'll move on to your back.
Okay.
All right. And do you mind if I take off your socks?
Yeah.
Okay. All right. Okay. Not seeing any swelling of the feet. No edema of the ankles, which is a really good sign. Okay, I'm going to do a Rubinski response test. Just trying to feel the reflexes of the feet. Okay, there we go. Beautiful. Now I'm going to be just judging the sensitivity of your feet, okay? So this is going to be a little bit difficult because the feet are the most, the least sensitive part of the body, but do your best if you feel 1 or 2 pressure points.
Okay. 1, 2, 1, 2, 1, 2, 2, 1, 2, 2, 2, 1, 1.
Okay. I'm going to try to bring your toes up towards yourself. Try to. Very good. Push against me. All right, very good. Any difficulty in doing that?
Mm-mm.
All right, great. So next I'm going to have you just sit up on the bed. I'm going to do an examination of the back and we'll be finished, okay?
Okay.
So do you mind if I untie up some of the back of your gown?
Yeah, that's fine.
Okay. Okay. First, I'm just going to listen, do a more in-depth listen. If you feel pain at any moment, please let me know. Okay. I'm going to do some percussions. Okay, just going to be palpating the spine, beginning with the cervical spine. Just feeling. I don't see any signs of scoliosis, lordosis. Okay. Do you see a slight curvature here? To examine the skin too as well on the back. Looks very healthy. Okay. I'm going to be drawing a wooden stick, and let me know if you feel it on the left or the right side.
All right. Right. Left.
Okay.
Right. 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 Left. 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 Right. Right. Left. Left.
Okay.
Right. Left. Left.
Good. And just take a temperature of the back in a couple places. Okay. Normal. Okay. All right. Just going to take a couple measurements just for my records of symmetry. That's 6.5 inches. 6.5 here. And 7. So that's proper symmetry. Okay. 4.5. Okay. 6 inches. 6. I'm just going from the shoulder down. 8. 7.5. Slightly asymmetric. 5 inches here. Just going to measure again directly towards the spine. 18 inches. Okay. Okay. And to end. Let me know again, wet or dry.
Okay. Wet. Dry. Wet. Wet. Dry. 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 Wet. Wet.
Okay. All right, Aziza, this concludes our session for today. You're extremely healthy. Your sensory test you did a lot better than what I thought you would. I just am having concerns with your sense of smell.
Okay.
So I'm going to refer you to a specialist to get that checked. And I'm going to just give you a follow-up call in about a week. These symptoms that you described, they are quite recent. So I'm hoping that they'll go away. In the meantime, I would just encourage you to stay away from the skincare thing that you were trying, the moisturizer, just to see, you know, maybe that might be the cause. And just pay attention to your daily habits. If they persist by next week, we're definitely gonna send you in for testing. You have great insurance, so we're gonna get you set up with the MRI, EKG, a lot of imaging to see what's going on there. But I just wanna give it a little bit more time before we do that.
Okay.
So I'll send you your referral up at the front. Thanks so much for coming in.
Thank you.
All right.